This video is part of the Infocare tutorial videos, which are designed to provide step-by-step instructions on how to perform cognitive, sensorial, physical and reminiscence activities remotely and through digital devices, as a caregiver of a person suffering from dementia. This video is specifically designed to explain how to perform the reminiscence activity called What Does It Do? Remotely with the person you care for, by using Amazon Echo Show device. To carry out the activity, make sure you are connected with the person you care for by using the drop-in function. For detailed instructions on how to use it, check the Infocare's Digital Literacy for Caregivers of Dementia Patients manual, as well as the drop-in video tutorial. With drop-in, the person with dementia does not need to pick up the call to get connected, easing the process. However, other softwares and devices for video calls can be used. Follow these tips to plan the activity in advance. Watch and learn from the next steps detailed in this video before starting the activity, rather than watching and doing the activity at the same time. This can smoothen the interaction and make it more efficient. Try to maintain a constant schedule and routine. Choose the most suitable time and frequency, depending on the person's needs, daily schedule and routines, etc. Inform the person about the activity and timing before it takes place. If the person is being aided by an external carer or professional, carry out the activity while this person is present. When you are connected, you can normalize the interaction through the devices by starting a conversation as you would do if you were both physically present in the same room. Use short and straightforward sentences, positive and simple language. Make pauses and adapt the pace if needed. Establish some simple rules and structure the dialogue, for example. Start with, "Hello Dad, it is me, John. How are you today?" Finish with, "I will call you tomorrow." Avoid questions that might generate frustration, such as, "Do you remember me?" or "Do you know who I am?" Be flexible and patient. If the activity is not going on well or the person is not interested, switch the topic and relax the environment. What Does It Do is a reminiscence activity that helps people with dementia to keep remembering the use of everyday objects. The activity consists of choosing objects that the person uses every day and whose functions they still remember. They can be personal hygiene items such as a toothbrush or a comb, as well as clothes, kitchenware, etc. Once the objects are selected, the activity consists of engaging the person in a conversation about the objects, by asking questions such as, "What is the name of the object?" or "What is the object used for?" Besides memory, this activity also stimulates other cognitive functions such as attention and reasoning. If the person still has mobility, it can also help with physical stimulation. To perform the activity remotely, make sure the following prerequisites are met. Both devices are connected through the drop-in function or a video call, in case you opt for another digital device. The person can listen and see you properly through the screen. The person is relaxed and motivated to engage with the activity. The objects selected for the activity are at hand, so the person with dementia can easily find them. If the person has vision or hearing problems, make sure they have their glasses or hearing aids in hand. There is also a tip that will make it easier. If you use an Echo Show device, in advance, while setting it up, make sure the volume is correctly adjusted. The device is paired with your mobile phone, as well as that the drop-in function and permissions are enabled. After setting up the devices and making sure the person is responding, you can start encouraging the dialogue and gradually engaging them into the activity with questions such as, "What object do you use to brush your teeth? Can you tell where you place it? Can you bring and show me the object? Can you put it back in its place?" The suggested time for this activity is 20 minutes, but you can adapt it according to the level of impairment and how well the person interacts through the digital device. If the person starts feeling anxious and you notice the activity is too challenging for them, you can stop the activity and reconduct the dialogue to a more pleasant topic. To personalize the activity, you can add different levels of difficulty. If the person has limited physical mobility or is living in a care center, you can just show them pictures of the objects through the device instead of asking them to find and bring the objects. If the person is still living in their home and can move, you can ask them to move through the house, find and bring the object before starting the conversation, and put it back in its place once the activity ends. If the person is responding well to the activity, you can increase the number or the difficulty of the questions, for example, by asking them to describe the process and connect the object with routines, by asking questions such as, "How do you brush your teeth? What other elements do you need to brush your teeth? How many times a day do you do it?" Amazon Echo Show devices have been used within the Infocare project framework for informative and training purposes. There are other digital tools that offer similar functionalities to enable the remote implementation of stimulation activities for dementia. Some examples are other virtual assistants, such as Google Nest Hub and local assistants in some countries. Video call software supported by smartphone, computer, and tablet. Some examples are Zoom, Google Meet, Skype, or WhatsApp. As a caregiver, you can choose the most suitable option depending on your preferences and the level of cognitive impairment of the person you care for.